Hello, viewers. Today we are going to talk about mental health and addiction. And to talk to us about these aspects, we have with us Dr. Janani, who is a psychiatrist with TTK, consulting with TTK Hospital, Adayar, Chennai. Hi, Janani.
Hi.
So, Janani, we see a lot of youngsters nowadays with increase in stimulant use, especially in Chennai and surroundings, increase in stimulants like cocaine and meth. We also see a lot of prevalence of digital addiction. It comes, it is combined with the digital addiction also. So, how does the clinical presentation seem to you? Does it become even more complex for you to treat and diagnose it? How do you, you know, um, approach such cases?
So I agree with you. I think there is definitely more digital addiction as well as stimulant addiction. It's rampant at this point. And definitely the presentation becomes much more complex because now we are looking at two different forms of addiction. The usage on one side is a drug, on the other side it is a gadget. But looking at this on the whole, one thing that we can see is they both affect very similar parts of the brain. They can have very similar presentations, which in itself is extremely confusing for the therapist or for the mental health professional who's seeing them, because the milieu of presentation that you see overlaps. So at some point, we're not sure whether this is caused by the substance or is this caused by the gadget in itself. So complexity in presentation is a definite thing. It requires, I think, help from all surroundings. It's not just the psychiatrist who can help the person out. So we need like a team effort to look at the entire thing. So if you look at some of the symptoms, say for example, with somebody with stimulant addiction, they start taking these drugs mainly because they believe it works on the brain. They believe that it's going to improve their attention, their focus, their concentration. Now that in itself causes them to become really hyper, isn't it? So when they're really hyper, there's again a need for these neurochemicals in the brain that require secretion because they want to feel that high all the time. That's when they latch on to something which is really available easily now, like a gadget. Now we know that everybody holds on to a gadget. We need it for our everyday, life. It's become like a necessity at this point. So one gives way to another, and that in itself becomes a problem. So when you're dealing with it, apart from the presentation, when you come on to the treatment aspect of it, now we're looking at pulling the person away from, let's say, the gadget, then the substance can worsen, or you work on the substance, the gadget can worsen. So it becomes a complex presentation together, definitely.
Again, we're talking about gadgets. And what kind of cases are you seeing, the trends, the emerging mental health patterns, especially with the rise in online gambling, crypto trading, especially among teens?
So we are now coming across, like you mentioned, gambling, which is starting at a much younger age. There are youngsters, adolescents who are into cryptocurrency nowadays. There's a lot of pornography that's available, that's widespread. And we're seeing kids as young as 13 and 12 who are in their pubertal period who get hooked onto these sites, as a result of which there is a sequelae of a large number of events that's happening. So online pornography can lead to bullying, there can lead to cyberbullying. So online pornography in itself has its own repercussions. So younger children getting hooked onto it, leading to a lot of misconceptions in the growing brain, right? They don't understand what normal sexuality is or normal sexual practices are. That in itself confuses the brain. So pornography is definitely an area that's really becoming very bad. And I think parents and families are not able to control because children nowadays require gadgets. It's become like the necessity, like I've already mentioned, right? With gambling, what's happening is the risk taking becomes more and more. There is immediate gratification that happens. So it's not only online that the gratification continues, offline also. So they seek immediate gratification in everything. There's impulsivity, there's poor attention, there's poor focus, academics drops, so many things. It affects all facets of their life, and that in itself becomes the next issue.
With a lot of information online, we are seeing people doing a lot of research before they come to you. We can call it medical shopping, right? In terms of mental health, they also research on what kind of therapy would suit them and what kind of medications would also help them. So how do you deal with this when they come up with misinformation like this?
I think that's a great question. I think I'm speaking for a lot of professionals here when I say that we have patients coming to us who have already Googled up a lot of their symptoms. They've even arrived at a diagnosis even before they meet a mental health professional. That actually puts a lot of pressure on us to an extent, right? Now, I understand that when patients Google up, it's also because they're very curious to know what's troubling them, and Google becomes something that's easy to access. Accessibility, I know in many parts of our country is still very difficult. Accessibility to a doctor is still very difficult. There are issues when it comes to finances. Not everybody can afford to see a professional immediately. So Google gives or online gives you that access. And so Googling is not wrong. So I appreciate that, patients want to figure out what's up with them, and then they want to come to us if they feel it's significant. So I think understanding where they come from, treating this with empathy, questioning them about their misconceptions, and gently prodding through till we can come to some sort of an understanding, I think really works. Instead of being dismissive or us just saying, oh no, you're wrong, I'm the professional here. I think that doesn't work. It further, I really think it worsens their insecurity. So talking to them, understanding them, I think really helps. And I think it's important that we clear misconceptions, because one wrong understanding that a person has, which is posted online, can go viral nowadays. And so a lot of innocent people look at it and they get confused by the whole thing. So things go viral for no reasons nowadays, isn't it? So I think it's important, and we have the responsibility as professionals to definitely look at misconceptions, clear it, and make sure that they understand it in the right light. So I think it's more of a therapeutic alliance that you build with the client. Absolutely.
After COVID, we've seen an increase in virtual therapy and telepsychiatry. What do you think are the advantages and risks, especially in treating addictions online?
Absolutely. I think COVID has paved the way for telepsychiatry. I think pre-COVID, we had very few patients who would actually want to have an online consult. And I don't think we professionals were also very comfortable. But after COVID has set in, it started off as a mandate. And now I think our population, our professionals, we're all very comfortable, talking to our patients online. When you look at advantages, there is definite ease. Right? It's the patient talks to us from the confines of their home. It's comfort. They don't have to step out. Money is not spent in terms of travel. Time is not spent. You're giving them an allotted time and you're seeing them at that particular time, which is comfortable to both parties. So I think the comfort is amazing. You have family support, people who can't probably travel with the patient, who want to give us information collaterally. We have their support when it comes to an online consult. And I think follow-up is a lot easier. I think people are more happier, or they find it more convenient. So they're quite happy with, scheduling frequent sessions if required, if it's an online consult. However, barring all of this, I personally believe that an online consult cannot meet the requirements, or it doesn't really work like how in-person consult works, isn't it? Because I think as professionals, we read a lot of non-verbal communication. It's not only the history that comes out from the patient or the family. There is a ton of information that we derive as the patient walks into the room, the way they walk, the way they sit. Their non-verbal communication gives us so much of information. So I think all of that is lost in a video call, right? And in addiction, it becomes all the more important for us to, sort of build the therapeutic alliance. And I think sometimes an online call doesn't really help with that. An offline, of course, consult, you can really work through a lot of these issues. So I understand it's convenient. I understand it works in places where there isn't access for people. But I think there are these cons also, especially when it comes to addiction, because patients can lie to us. I'm sorry to say. There are things that you may not find out unless you meet the person. You can miss a lot of withdrawal symptoms in addiction online. That could be masked. And some of them may actually require emergency care, which cannot happen if it's an online consult.
And even when you talk about psychiatric clients or self-harm,
correct.
How do we observe all that?
Absolutely. That is, I think that's really true. Let me ask you a question. So Soumya, do you think that over the years, you've been a part of TTK for quite some time now. So do you think over the years, your clientele has changed in terms of the difficulties they come in for? Has the age group changed? What are your observations?
The profile is definitely changing. We can classify as pre and post COVID actually. Post COVID, we've seen a rise in other kind of substances. Earlier, our clients were predominantly alcohol, came in with alcohol addiction. Post COVID saw a rise of other substances and cannabis being, really free flowing due to, I think, lack of alcohol supply during COVID. That said, we're also seeing the age of initiation coming down. So we have earlier in a year, we probably had inquiries for a minor client, maybe one or two. Now every month we have at least 2 or 3 cases of minors coming in. So the profile is changing. The complexity of addiction is also changing with, again, digital addiction, which is there at the background for almost most of the clients.
Absolutely.
So that being said, I think it's becoming very complex.
And there's polysubstance, isn't it?
Yes.
One person is now consuming
different kinds, and the accessibility has increased. I think with the peddling, they get the resources to explore other substances. So the polysubstance abuse is also increasing. Earlier, we used to hear meth or cocaine. It used to be like maybe in a place like Bangalore or Mumbai. In Chennai, it was very rare because the affordability was not there, or it was in some rave parties. But now we see that college students have started peddling and it is freely available. So polysubstance also, yes, that there has been an increase.
And I think to add to that, our medical comorbidities have also
increased. And I think psychiatric comorbidities also have increased. So earlier, in a week, if we had, say, 10 clients that we showed to the psychiatrist, now it's about 25.
Absolutely.
Easily on a day. Yes. So we feel the psychiatric comorbid conditions have also kind of increased, or it's coming up to the surface. Right. So yeah, it is becoming a very complex affair with more the need for a multifaceted team to work together. So that is also, the need has become even more important. It's very important. It was always there, but now we see that it's like all hands on the deck with the client. Yes. Thank you, Janani, for your time and your expertise. I'm sure many of our viewers have benefited from your perspectives. Thank you, viewers. I hope this episode was useful for you. Hopefully, we meet again. Thank you.